And now some welcome news, even if it's not everything we want. The CDC has begun to officially walk back its 2016 guidance on prescription opioids, which was chock full of misinformation that resulted in the torture of chronic pain patients, many of whom ended up committing suicide. The 2016 guidelines caused immense harm as they were pushed by gleeful drug warrior law enforcement officers looking for excuses to violate people's rights, politicians who have millions of pain patients to scapegoat, state medical boards who never saw medical fascism they didn't like, and insurers who loved excuses not to pay for these things. Losing out, of course, were pain patients and their doctors. The report is full of these political hacks trying to evade accountability for their horrible position, claiming that their guidelines were misapplied, which they acknowledge resulted in, quote, untreated and undertreated pain, serious withdrawal symptoms, worsening pain outcomes, psychological distress, overdose, and suicide. All of which was a result of them following the guidelines. And the result was the real opioid crisis, a crisis of untreated and undertreated pain where many pain patients saw their medicine rapidly reduced or cut off entirely, often with grave consequences, including not only suicide, but also overdose as they turned to the black market in desperation. The new guidelines cover the use of prescription opioids for both acute pain after surgery and chronic pain. The guidelines could affect as many as 1 in 5 Americans. Christopher Jones, acting head of the CDC's National Center for Injury Prevention and Control, said, quote, the guideline recommendations are voluntary and meant to guide shared decision-making between a clinician and patient. It's not meant to be implemented as absolute limits of policy or practice by clinicians, health systems, insurance companies, governmental entities. Dr. Samer Narouza, president of the American Society of Regional Anesthesia and Pain Medicine, said, quote, you can tell the culture around the 2016 guidelines was just to cut down opioids, that opioids are bad. It's the opposite here. You can sense they are more caring about patients living in pain. It's directed more towards relieving their pain and their suffering. It remains to be seen if state and federal authorities pay any attention to them or continue on their psychotically destructive path. Northeastern University law professor Leo Beletsky said, quote, CDC needs to be a lot more proactive than just putting out this update and trying to walk back some of the misinterpretation of the previous version. Referring to the daily limit of 90 morphine milligram equivalents in the 2016 recommendations, quote, the 2016 guideline itself was clear that this was not a bright line rule, but it became a de facto label separating appropriate and inappropriate prescribing. And he pointed out that law enforcement even uses it, quote, as a sword to go after prescribers. Cindy Steinberg, patient advocate with U.S. Pain Foundation, said, quote, most people that I know, and I know a lot of people living with chronic pain, have already been taken off their medication. Doctors are incredibly fearful of prescribing at all. She points out that, even with the update, the guidelines are still way too restrictive and won't make much difference to patients who have already been hurt by all this. They did at least get rid of the arbitrary limits, as well as warning doctors about rapidly tapering or discontinuing opioids. But Stefan Kertesz, professor of medicine at the University of Alabama at Birmingham, said, quote, I would emphasize that when you take a stable patient and reduce their medicine, you're engaged in an experiment. Dose reduction is simply an uncertain intervention that sometimes helps and sometimes causes the patient to die. I would rather they have said, look, this is an uncertain intervention. It will have absolutely no effect unless 3 major agencies take action immediately: the DEA, the National Committee for Quality Assurance, and the Centers for Medicare and Medicaid Services. All 3 agencies use the dose thresholds from the 2016 guideline as the basis for payment quality metrics and legal investigation. Dr. Antje Barreveld, medical director of the Pain Management Services at Newton Wellesley Hospital, hopes that this will reverse the trend of pain patients being unable to find treatment because doctors are too scared to prescribe it. She describes one case, quote, I recommended to the primary care doctor to start low-dose opioids, and the primary care doctor said no. What happened? The patient was admitted to the hospital, thousands of dollars a day for 8 days, and what was she discharged on? 2 to 3 pills of an opioid a day. It's at least a start at an improvement. Unfortunately, when I picked mine up at the pharmacy yesterday, I was given literature with the same old fear-mongering propaganda. It began with an outright lie. Quote, prescription opioids come with serious risks, including dependence, addiction, and even death. It says prescription opioids are responsible for 40 deaths a day. Of course, as we've covered repeatedly, they're just blaming prescription opioids for what's actually happening due to illicitly manufactured fentanyl on the black market. The pamphlet goes on to fearmonger about overdose, which is practically impossible with prescription opioids, and more than 1,000 people are treated at emergency rooms daily when, again, it's black market fentanyl that's to blame. And also, like we've covered, they're ignoring the problem of polypharmacology, taking opioids along with alcohol and other illicit drugs. The most damaging is the line, opioids should not be the first line or routine therapy for chronic pain. When, if anything, it's by far the best and safest tool that pain patients have. And that's something that the new guidelines do nothing to counter. It's nothing but a pack of bald-faced lies that only make people afraid to take the medicine they need. It's as harmful as it is psychopathic. So we'll see how long it takes everyone to get the idea, and if the CDC moves forward with it to even more sensible recommendations.